Joel Embiid just underwent emergency surgery for appendicitis, but what exactly does that mean for his body and, more importantly, his recovery timeline as an elite NBA athlete? Today we're going to be breaking down what appendicitis actually is, what the appendix does or doesn't do, why surgery is necessary, and how long it takes an athlete like Embiid to return. So what is appendicitis? So if we take a look at our anatomical model here, we're going to remove the small intestines. If we go really deep and take a closer look at the large intestine seen right here, we see this tiny little extension of the large intestine. That is your appendix. From a posterior view, it is a small tube-like structure that attached to that large intestine. When the appendix becomes blocked, or often by stool infection or swelling, it can become quickly inflamed or even infected. That can lead to some issues like severe abdominal pain, typically in that right to lower quadrant where it's located, nausea and vomiting, and even a fever. So the danger, if left untreated, the appendix can rupture and spill infection into the abdominal cavity. This is called peritonitis, and it can be definitely life-threatening. So interestingly, the appendix is considered a vestigial organ, meaning that we actually don't need it to survive. So when it does become inflamed, like it did in this instinct for Joel Embiid, removing it is usually the safest option. So in Embiid's case, the key word is emergency. So when the appendicitis is diagnosed, surgery called appendectomy is typically done to quickly prevent this rupture. This surgery's primary goal is to remove that appendix and remove that due to the fact that it is inflamed so that it does not cause any more harm to the internal organs of the body. So what does recovery look like for someone like Joel Embiid? If no rupture, the best case scenario is that there's light activity within the first few weeks, return to training in 2 to 4 weeks, and then full return to play in 3 to 6 weeks. If there was a rupture, recovery can easily extend to about 6 to 8 weeks, maybe even sometimes longer. So for NBA players, the biggest concerns are core strengthening, so abdominal muscles that are involved in everything, conditioning loss, as well as a risk for hernia at the incision. The reason this is a big deal, and especially for return to play, is that the abdominal region is crucial for stability, power transfer, as well as rotational movements. So even though this isn't a basketball injury like a knee or ankle issue, it still affects explosiveness, balance, and endurance. So while an appendicitis does sound scary, and it is a very serious condition, it also is a very treatable condition with a strong recovery outlook. So for Joel Embiid, he is also listed as not going to be playing at all in the play-in tournament, and in order for him to return, if they do make a run in the playoffs, it's going to be avoiding complications, gradually rebuilding conditioning, as well as safely returning to game shape. Hope you guys enjoyed this video. Let me know if you have any questions or comments down below, and thank you so much for watching.